When should you call a doctor for flu symptoms in children? Most children with the flu recover at home with rest and fluids, but knowing when to seek medical help is crucial. Some symptoms can signal serious issues that need prompt attention. If your child is very young, has underlying health conditions, or shows certain warning signs, calling a healthcare provider can make a big difference. Flu symptoms in children tend to come on suddenly and can be more intense than a cold. Common signs include a high fever, headache, body aches, chills, tiredness, cough, sore throat, and a runny or stuffy nose. Sometimes children, especially very young ones, may only have a fever or seem unusually sleepy or irritable. Vomiting or diarrhea can also occur, particularly in young children. Parents should contact a doctor if their child is under 5 years old, especially under 2, because young children are more prone to complications. Children with chronic health issues like asthma, diabetes, heart disease, or weakened immune systems are also at higher risk for severe illness and should be seen by a healthcare provider early. If your child shows signs of dehydration, such as fewer wet diapers, dry mouth, or sunken eyes, it's important to get medical advice. Call your doctor if your child's fever lasts more than 3 days or if it comes back after improving. If your child is very sleepy, difficult to wake, or refuses to drink fluids, these are signs to seek help. Also, if symptoms worsen after initial improvement, it's best to get professional guidance. In case your child has trouble breathing, their ribs are pulling in with each breath, or their lips or face turn bluish, these are emergency signs. Seizures, unresponsiveness, or a fever over 104 degrees Fahrenheit that does not decrease with medication also requiring immediate medical attention. Severe dehydration signs like no urination for more than 8 hours, dry mouth, or sunken eyes are urgent concerns. Infants especially need quick care. Any illness in a baby under 3 months, especially a fever, should prompt immediate medical contact. Children with chronic conditions like cerebral palsy, epilepsy, or muscular dystrophy are at increased risk for complications and should see a healthcare provider as soon as flu symptoms appear. Early treatment with antiviral medications may be recommended for these children to help reduce severity. Parents should monitor symptoms closely, especially in the first few days. Encourage rest and fluids to prevent dehydration. Use fever reducers as directed by your doctor, but avoid aspirin in children because of the risk of Reye's syndrome. Keep your child home from school or daycare until they are fever-free for at least 24 hours without medication. If you're unsure whether symptoms warrant a visit, call your healthcare provider for advice. Getting vaccinated against the flu every year is the best way to protect children from severe illness and complications. The flu shot is recommended for all children 6 months and older, especially those with higher health risks. Remember, most children recover without complications, but being vigilant and knowing when to seek help can keep your child safe. Always consult a healthcare professional for personalized advice and care.